On occasion, a procedure may be performed under local anesthetic alone. These types of procedures include such common operations as vasectomies, removal of skin lesions, dental extractions, and laser surgery. Newer cosmetic procedures such as thermage or transcutaneous radiofrequency tissue tightening and some laser treatments are also done under a local. Local anesthetics can be administered through needles or by creams or drops. Some procedures are performed under sedation with or without local anesthesia. Currently, many eye surgeries are accomplished with intravenous sedation and the administration of injected or topical anesthetics on or behind the eye. Many endoscopy, colonoscopy, and upper GI endoscopy procedures are performed using sedation alone. Just because it is only a sedative does not mean there is less risk. In fact, the risk for sedative procedures is about the same as the risk for general anesthetic. Sedative drugs blunt your ability to respond while minimizing the sense of pain. Though rare, a patient can potentially experience partial or complete airway obstruction. For this reason, it is imperative that someone who is skilled in airway management attends all procedures performed under sedation.
So back to the questions. Will I be awake during surgery? Will I have awareness of the surgical event? As you now know, the answers depend upon the anesthetic technique employed. Some patients are awake, as with regional or local anesthesia. Some patients will have awareness of at least a portion of the procedure, such as those undergoing regional or local anesthesia with sedative drugs. A patient scheduled for general anesthesia should not expect to have a significant memory of events occurring during the operation. Patients may have recall of events before entering the operating room, exiting the operating room, or early in the stages of recovery. Often preoperative or initial anesthetic medications confuse the mind's ability to appropriately file memories. If a patient truly fears any awareness factor, it's important to mention this to the anesthesiologist. He or she can utilize additional or alternative medication to relieve anxiety associated with this fear.
You have probably noted that with few exceptions, anesthesia involves establishing an intravenous line or IV. In exclusively local or diagnostic cases, an IV may not be required, but where there is general anesthesia, regional anesthesia for surgery, or sedation, it should be routine. There are several reasons for this. Primarily, IVs are used to administer medications and fluids during the procedure, but they also provide immediate access to the patient should an emergency occur. In the case of a regional anesthetic for surgery, the IV provides a mechanism to shift to a general anesthetic if necessary. This may be required if the surgery takes longer than anticipated, or if the surgery must extend beyond the original boundaries. This same intravenous line is often used in recovery to give medications to manage pain. You may find this ironic since a common question is, why does it hurt to start an IV? The simple answer is, it shouldn't. It is easy, inexpensive, and risk-free to put a local anesthetic at the IV site before starting the IV. Extra fine needles or creams can be used to numb the IV area comfortably.